Today, I am going to demonstrate the assessment of lung and thorax. Prior to performing the procedure, introduce yourself and verify the client's identity using the agency protocol, and explain what you're going to do and why it is necessary and how he or she can participate. So good morning, sir. I am Jonah Mayfield, a student nurse. May I know your name?
My name is Sean Vincent F. Tabeta.
Okay. When is your birthday?
2011, August 17.
Okay, thank you. Then perform hand hygiene and observe other appropriate infection prevention procedures. Then provide for client's privacy by closing the door or closing the brakes. Inquire for the client's history. Sir, I will just ask some questions. Is that okay?
Yes?
Do you have some allergies?
No?
How about tuberculosis in the family?
No?
Do you smoke?
No?
Or are you taking some medicines?
Yes?
What is it? Okay, sir. Now I will start to inspect your chest. I will ask you to remove your shirt. Is that okay?
Yes?
The thorax is symmetric. Inspect the spinal alignment if the client consent, and observe the normal curvatures of cervical, thoracic, and lumbar. Okay, sir. Can you bend your head and your back? Okay, thank you, sir. The spine is vertically aligned and spinal column is straight. The shoulders and the right and left shoulders and hips are at the same height. Then palpate the posterior thorax, assess the temperature and integrity of all chest skin. Then for clients who have respiratory complaints, palpate all thorax areas for bulges, tenderness, or abnormal movements. So the skin is intact and the temperature is uniform. The chest wall is intact and there's no tenderness and no masses. Next is to palpate the thorax for respiratory excursion. The client has full and symmetric thorax, so it's normal. Palpate the thorax for tactile fremitus. Can you say lumon? Okay. 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 Thank you. The fremitus is felt most clearly at the apex of the lungs. It is a bilateral symmetry of fremitus. Next is to percuss the thorax to determine whether underlying lung tissue is filled with air, liquid, or solid material, and to determine the positions and boundary of certain organ. Okay, sir, I'm going to touch you. Is that okay?
Yes?
So percussion notes resonate except over scapula. Lowest point of resonance is at the diaphragm, and the percussion on a rib normally elicits dullness. Next is to auscultate the thorax using the flat disc of the diaphragm. Vesicular and bronchovesicular breath sounds are heard. For the anterior thorax, first is to inspect the breathing patterns and inspect the costal angle. It is quiet, rhythmic, and effortless respiration. The costal angle is less than 90 degrees and the ribs insert into the spine at approximately a 45 degrees angle. Next is to palpate the anterior thorax. It has full symmetric expansion. Thumbs normally separate 3 to 5 centimeters. Next is to palpate for the tactile fremitus. Okay, sir, when I touch your chest, you say lumon. Okay, thank you, sir. Same as for posterior fremitus. Fremitus is normally decreased over heart and breast tissue. Next is to percuss the anterior thorax. The percussion notes resonate down to the 6th rib at the level of the diaphragm, but are flat over the areas of heavy muscle and bone, dull on areas over the heart and the liver, and tympanic over the underlying stomach. Next, also take the trachea. Bronchial and tubular breath sounds is heard. Next is to auscultate the anterior thorax. Bronchovesicular and vesicular breath sounds was heard.
Document findings in the client record using printed or electronic form.